to understand that. So LDS part 1, a bit difficult to apply with them, but once you apply, then you get into part 1 without IELTS. Overseas registration examination, we're going to speak about that in a moment. All right, so that's in regards to dentistry in the UK and the pathways that you have as an opportunity to work in the UK. Now we're going to speak about overseas registration examination. You will find more about it in our website, which is www.qualifymax.com, or on our Facebook page. So first, we're going to speak about general information. So who requires to sit ORE exams and who's exempt? So basically, as I said, the exemption is either a European dentist that qualified from Europe, or British dentists that stayed in Europe for about 6 months. Then they apply for qualifying their registration or their certificate. Other exams that get sometimes misunderstood, or people think, or dentists think abroad, that will qualify them to work in the UK, which is MJDF. And the MJDF will not allow you to work in the UK, but it's a membership diploma. And now it's actually discontinued because the joint dental faculties now is being split to 2, which is Royal College of Surgeons and the FGDP, of the Faculty of General Dental Practitioners, and each one of them will have their own exam. The second is MFDS, which is 2 parts. Again, it's the same thing. It's an honorary exam. It does not allow you to work in the UK. And obviously the LDS, which we spoke about, which is a license in dental surgery, one of the oldest exams that we have in the UK. It will give you both. It will give you a membership and will give you the registration, or the right to be registered in the General Dental Council. Worth mentioning that in 2010, end of 2010, there was an LDS Part 2 exam that was disqualified by the General Dental Council, which means that the people, or the dentists that passed the exam in LDS, were not registered in a General Dental Council. So this, because it's 2 different bodies, and the GDC is the one that overlook all the registration, they can say that one of the exams are not accepted, and therefore it will be disqualified. So that's worth mentioning that. Okay. So that's in regards to the pathway to be a dentist in the UK, whether visa or the exams itself. And we know now that MFDS and MJDF and MFD and all these exams will not qualify you to work in the UK. They are honorary. They're good to increase your skills and make you a better dentist, but they're not going to qualify you to work in the UK. Now, we're going to speak more about the ORE. As far as we know, it's still standing. Nothing is changing in it, but maybe they're changing a bit of the blueprint, which I'm going to speak about a little bit later on. There's something that maybe no one else can actually speak about yet, because there's no confirmed information about it yet. So the ORE exams, it will have 2 parts, which is part 1 and part 2. Part 1 normally runs in King's College in London, while part 2, it runs in different groups, and they have 4 components. Mainly, they use the Royal College of Surgeons for the OSCE's exams, which we're going to speak about it in a minute. So part 1. So there are two exams that based on computer. We have 2 papers, paper A and paper B. Paper A covers clinically applied dental science and clinically applied human science, while paper 2 covers aspect of clinical dentistry, including law and ethics and health and safety. Each paper will last for 3 hours, and it has MSA, which is multiple short answers questions, and extended maths questions with single best answer questions too. So the dates that we had prior to COVID-19 is April and August. That's for part 1. So it happens twice a year. And the fees are, until now, is £806. That can increase once they release the dates for the new exams. That's in regards to paper 1 or part 1 exams, dates and fees. As in regards to the papers, again, this video will be cut in small videos and will be on our website, and it will be on Facebook. So if you needed any of this information, you should find it in our Facebook page or website easily. So these are the topics that we would expect in paper A, while paper B is more applied clinical dentistry, as we see here. So some topics would be important to know, and to know in depth and details. The samples that we have for an extended match questions. So the extended match questions will have a sort of answers and scenarios, and then we match the scenario for each answer. Sometimes the answer can, the answer can be in more than one scenario. So it can be repeated just to make it a bit complex or complicated a little bit. While the single best answer question, we have some samples here where we have the question and then we have 4 or 5 answers. Each one of them can be right, but you'll find the best answer out of them. So quite a few questions that get repeated. These samples that we have from the website, from the General Dental Council website, are important to understand. So you get a scenario that you need to read it in thorough, and then you need to answer each scenario as it may be suitable for. While part 2, the price of it is £2,229. And again, these prices can change once the GDC announced the new dates for the exams. And they normally run 3 times, sometimes 4. And most probably, if they open it, they will have to run it more frequent. And that's where everything is stuck with the General Dental Council because of, obviously, the COVID-19. But normally it's January, April, and September where we have the exams for part 2. Part 2 will have 4 components. All of them are important to pass. So if you fail one, you fail all, except of the medical emergency. If you fail it, then you can repeat it afterwards as a separate component. So we have the medical emergency, which has scenario-based. They will ask you questions, and they will ask you to do a CPR or cardiopulmonary resuscitation. While for the dental treatment planning, normally you have an actor, you have examiners, and they will assess your history taking, diagnosis, and treatment planning. So this is how the structure will be. So you'll have different timing for each one, and you will be trained for it before you go to the exam. Next one is an OSCE, which is a stations, which is very similar to MFDS or MGDF if any of you did it. And some of them will have actors, some of them will have a written exam, and some of them will have hands-on. And there will be a maximum of 20 stations, and the OSCE lasts normally 2 hours in total. And finally, the dreaded mannequin exercise, which would need lots of exercises before getting into the exam, because obviously the stress of the exam, but once you master it, you can pass it easily. And it has a structure where we know exactly what they're going to ask for and what they're looking for. And that's really important for you